Good evening, everyone. Thank you so much for joining us this evening. My name is Amirah Sequeira. I'm the Legislative Director for National Nurses United, working out of Washington, D.C., and I'm joined this evening by my good friend, Eagan Kemp, who is the Healthcare Policy Advocate at Public Citizen. Eagan and I are here tonight to give you an update on the state of Medicare for All in Congress. I'm going to start tonight talking you through all of the updates on our Medicare for All bills here in DC and Congress. And then Egan's going to talk more about the things we need to do to move this bill forward in Congress in the coming months and years. So to start us off, we continue to make substantial progress in the fight for Medicare for All in Congress. It is true that progress at times can feel slow, but because of the really strong grassroots movement we have built across this country, all of us working together in solidarity with one another, we are seeing each month an increase in the amount of support and the amount of discussion that Medicare for All is receiving in both the House of Representatives and in the United States Senate. I'm going to first start by updating you on the situation in the House of Representatives. So this might be a reminder for some of you, it may be new information for others, but we introduced our House version of the bill last March, a year ago, in March 2021. And when we introduced that bill this session, and the bill number is HR 1976, we introduced it with 112 co-sponsors. It was a really strong group of Democrats, and it included Democrats from all parts of the Democratic Party, all of the most progressive members of Congress that we would expect, but also because of the serious grassroots organizing work that our movement has been conducting across the country, we added a number of members to that original co-sponsor list that are typically more moderate in their politics and that hadn't actually supported Medicare for All before. So I want to note one specific addition to that co-sponsor list when we introduced the bill in March, and that was Energy and Commerce Chairman Frank Pallone from New Jersey. So Mr. Pallone is a very powerful member of Congress. He chairs one of the most powerful committees in the House of Representatives. And we as a movement have been pressuring Mr. Pallone to join this bill and to support Medicare for All for years. So a big shout out here to the activists in New Jersey who have been talking to Mr. Pallone, protesting Mr. Pallone, bothering him about the need to support Medicare for All, sharing their patient stories, sharing their healthcare worker stories about why we need Medicare for All. His committee is a very important committee of jurisdiction, and we all got a wonderfully welcome surprise right before we reintroduced the bill last year when Mr. Pallone joined as an original co-sponsor. So that bill was introduced in, like I said, March 2021 with 112 co-sponsors. Amongst those co-sponsors were 14 chairs of important committees in the House of Representatives. Since last March, in the year since, together our movement has been mobilizing in districts across the country to convince other members of Congress to support the bill, to co-sponsor the bill. As a result, we have gone from 112 co-sponsors to 121 members of Congress supporting this bill. I want to just call out a few of those exciting additions. One of the people who got on the bill was Congressman John Garamendi from California's 3rd District. Shout out to all of the activists in California's 3rd District. He finally joined the bill in December. And he joined the bill after months of escalated activism in his district. There were car caravans to pressure him to get on the bill. There were numerous lobby meetings to get him to join the bill. And Mr. Garamendi had supported single payer in its previous iteration when John Conyers, was the sponsor in Congress. But it took an immense amount of pressure over the course of a few years, but a real escalation of activist pressure in the fall of 2021. And he finally joined the bill in December. It was a huge victory. Then at the beginning of February, so a month ago, February 2022, we had 1 week where 3 new members of Congress joined the bill. Shontel Brown, who is the new Congresswoman from Ohio's 11th District, Dawn Norcross, who is from New Jersey's 1st District, and Sheila Cherfilus McCormick, who is the newest member of the House of Representatives. She's the Congresswoman from Florida's 20th district. She took over the seat from Mr. Alcee Hastings, who sadly passed away last year. All three of them joined the bill literally in the same week. It was an excellent week for Medicare for All in the House of Representatives. So I just want to say that I know that this sort of grind we've been all participating in together for a number of years of really increasing activism in different districts to then get members of Congress to co-sponsor the bill. I know that it can feel slow, and I know that it can feel frustrating. But as Eagan will talk about more later, this work to get members of Congress on the bill is critical to building the sort of support in Congress and in the Democratic Party that we need to eventually win Medicare for All to pass this bill. So that's largely where we are on the House bill in terms of support. While this has been going on, the Medicare for All Caucus, which was launched a few years ago, which is chaired by Congresswoman Pramila Jayapal and Congresswoman Debbie Dingell, who are also our lead sponsors of the bill, our Medicare for All Caucus has been active in recent months, doing a number of briefings for the members of the caucus and the congressional staffers of those members of the caucus. So these briefings are a really great opportunity for members of Congress and their staff to hear from experts, healthcare experts, Medicare for All supporters, from patients, from doctors, from nurses, from folks that deeply understand Medicare for All policy. So they've been a wonderful opportunity for deeper education. The reason this is important is because not only do we need to increase the number of members of Congress who have co-sponsored this bill, but we need to make sure we are increasing the number of champions we have on this bill, and that we're educating these co-sponsors so they more deeply understand why we need to pass Medicare for All in full, why the policies that are built into the Medicare for All bill are so critical to improving healthcare in this country and ensuring guaranteed access to care. We have also, in the past couple months, been moving forward on additional congressional committee hearings in the House of Representatives. So in 2022 so far, we have now had 2 hearings in the House of Representatives. The first was in the Education and Labor Committee, which is a committee of jurisdiction. This hearing was on, broader universal, pathways to universal health care. But the witness list included the former Secretary of Labor, Robert Reich, who is a strong Medicare for All supporter. And he did an excellent job laying out the strong case for Medicare for All. As we've seen in previous hearings that we held in the last session of Congress, when we secured 4 congressional committee hearings, you really, if you any thinking person would walk away from that hearing, listening to the witnesses, listening to the questions and the answers, realizing that Medicare for All is the real solution we need to the healthcare crisis we are in this country. Congresswoman Jayapal, who's the lead sponsor of our bill, was able to be at that hearing and to ask really useful questions of the witnesses and specifically of Mr. Reich. Then just this week, we had our second hearing of this year in the House Oversight Committee. This hearing went extraordinarily well. The House Oversight Committee had 2 panels. First, they had a panel of patient witnesses who really grounded the committee in the horrors of the American healthcare system and why it is so critical for patients, for working families, for people with disabilities, why it is so critical that we change over to a full Medicare for All system. That was then followed by an expert panel that included Adi Barkan of Be a Hero and multiple other witnesses who, again, really made the case in a very strong way for Medicare for All. Now, the reason that these committee hearings are important is because part of the legislative process, part of getting to a place where we can pass a bill, is making sure that committees of jurisdiction have done hearings on these bills in regular order, the regular legislative process. You don't pass a bill, you can't pass a bill without the committees of jurisdiction holding hearings and then holding markups where they vote on the bill and they amend the bill. That's a really critical piece. And so by doing these hearings, we are once again providing an excellent opportunity for deep education for members of Congress that support the bill or that might not support the bill yet. So overall, this is where we are in the House. Before I move to the Senate, I want to just flag one more thing for you. Over the course of the past year, many of you will know the Biden administration and many advocates across the country were fighting hard to pass the president's Build Back Better agenda. It was absolutely a victory of the Medicare for All movement that President Biden supported lowering the Medicare age and improving Medicare to include coverage for hearing, dental, and vision care, and to ensure that Medicare could negotiate the cost of prescription drugs to then lower the cost of prescription drugs nationwide. I bring this up because what we saw in the past year is that many members of Congress who we haven't yet gotten on board with Medicare for All, we were able to get them on board with expanding Medicare. And these policy asks: improving Medicare to cover dental, vision, and hearing, prescription drug price negotiation for the Medicare program to lower the cost of drugs, not only for the Medicare program, but for the rest of the country, and lowering the age of Medicare. Those are things that do happen in the Medicare for All bill. They are fundamental parts of reaching an improved Medicare for All system. And so I just want to flag for everyone that there are a number of members who were more deeply educated in the past year on the importance of improving and expanding Medicare, which I think provides a great new stepping stone for us to then bring those members on to support Medicare for All in its entirety. So now I'm going to move over to the Senate side. And we have really exciting news. This conference is coming at a great time because Senator Bernie Sanders has decided to reintroduce his Medicare for All bill in the Senate in the coming weeks. So we are now in a really critical moment for in the Medicare for All fight this congressional session, because as many of you know, when we know that our bill is being introduced, we have an opportunity to rally our folks across the country to put as much pressure as possible on our senators to get them to join the bill as an original co-sponsor. It gives us a deadline by which they have to get on. It gives us an opportunity to really create buzz around the bill in the Senate and in states across the country. So our job in the coming weeks is going to be to make sure that we get as many senators to join Senator Sanders' bill in the Senate by the time that he reintroduces the bill. Last session, there were 14 co-sponsors of the Senate Medicare for All bill. It's really critical that we try to get all of those co-sponsors, and for those who left the Senate, that we get the folks who replaced them in their Senate seats to join the bill. But we also have a great opportunity to convince some new senators to either get back on the bill because they got off the bill last year, or to join the bill for the first time. And I just want to note that the COVID pandemic gives us a new lens by which to approach this conversation with senators across the country who have not previously supported Medicare for All, and would really encourage all of us to consider that as we begin doing our outreach to our senators, as we begin meeting with them, making calls to their offices, to really use this moment that the pandemic has shown us that we need to transition to a guaranteed healthcare for all system, and we do that through Medicare for All. It's I think a really great inflection point at the moment as we prepare for this Senate bill introduction. So that wraps up my section. Thank you all. It's great to be with you all today, and I'm going to pass it over to Eagan.
Thanks so much to Amirah for highlighting where we are in the fight for Medicare for All in Congress, and to Healthcare Now for hosting this conference, which is always fantastic and always a pleasure to be at. My name is Eagan Kemp. I'm the Healthcare Policy Advocate for Public Citizen, and it's a pleasure to be with you all virtually today. I'm heartened by the progress we have made as a movement on Medicare for All, and that we will soon have a chance to bring even more attention to Medicare for All with the forthcoming launch of Senator Sanders' Medicare for All bill. In addition to Amirah's update on sort of the on the ground of what things look like on the Hill, we thought it may be useful to take a step back and highlight what it will take to win Medicare for All from a legislative perspective. And so to just give a brief overview, so you know where I'm headed, I'm going to talk a little bit about the pieces that need to be in place to pass Medicare for All, How exactly Medicare for All would pass, sort of what it would look like, as Amir referred to, sort of the regular order by which bills pass. Also, what factors could make it easier or more difficult to pass Medicare for All, and finally, some steps that you can take to help make Medicare for All a reality. There are a few fundamental things that just absolutely have to be in place if we're going to pass Medicare for all. First, and I guess most obviously, Democratic control of the House, Senate, and the White House. Given GOP opposition to any positive health reforms, no matter how small or popular, it's just unrealistic to expect any of them to sort of jump over to the good side anytime soon. This will include needing 60 seats in the Senate because of the filibuster, unless we can change it or get rid of it. And as we saw, with Congress attempting to pass Build Back Better, which obviously, had a lot of great things in it, including on healthcare, a narrow Senate really can struggle to pass anything. And because of the complexity of Medicare for All, we can't rely on the reconciliation process, which is what they were trying to use for Build Back Better, which has a lower threshold of only 50 votes. There's so many important provisions in Medicare for All that that process just wouldn't be possible. Another important thing that we're going to need is an overwhelming number of co-sponsors, including in leadership in both the House and the Senate. It's going to take, a fight, and industry is going to be up against us the whole way. And having leadership ready to have that fight and having them have the support of their members is going to be crucial. And finally, and most importantly, massive grassroots movement and pressure, enough to push back on the huge moneyed interests that profit off of our healthcare system and will spend almost anything to kill any reform, as we saw with surprise bills and Build Back Better, uh, but especially Medicare for All, which will really turn off the spigot for their profit. Turning a little bit to what Medicare for All passage would actually look like, there's a couple pieces that are actually in common between the House and the Senate. The first, and Amira flagged this, and just it's such an important piece, is hearings in key committees that lay the fundamental groundwork and highlight the absolute need for Medicare for All. We call this as sort of building the legislative record. It's really an important piece so that staff understand it. Members of Congress understand it, and it also helps with sort of the outreach, and the awareness of the press, and sort of the general discussion around healthcare in the country. The next step is the committees of jurisdiction would mark up the legislation, the Medicare for All legislation, meaning they would take the legislation as introduced, make changes to it within their committees before voting on it, and then once they've all done so, sending it to the floor of either chamber for final passage. That brings us to the next step, which would be floor debate and passage. While there's some differences in rules and procedures between the House and the Senate, the crucial thing is that would be one of the many and sometimes the most dangerous opportunity to try to pass bad amendments by corporate-backed politicians. We often see, even when good bills get to the floor, really cynical ploys to try to peel off votes or to try to tank the whole bill. And so this is going to be a crucial step once we get there to be having folks be vigilant and making sure that we get it over the finish line. A couple things specific to one chamber or the other. In the House, as Amira discussed, sort of the most recent legislation, HR 1976, it's been referred to 7 committees because healthcare touches on so many aspects of our lives. Among these, the most important will be House Energy and Commerce, House Ways and Means, and House Education and Labor. And so the having champions on each of those committees, in the leadership of each of those committees, will be crucial to having positive hearings, positive markup, and then eventual passage to the floor. And then in the Senate, the real key here committees are going to be Senate Health, Education, Labor, and Pensions, often referred to as HELP, the Senate Finance Committee, and the Senate Budget Committee. There's still other committees of jurisdiction in both chambers that it'll need to go through and be marked up by, but those are going to be the ones that come to mind most, and where we want to make sure we have some of our best champions fighting the good fight. Um, the next area I want to turn to are sort of the factors that will make it easier or harder to pass Medicare for all. One of the most important, and this sort of takes a little bit of a step back from healthcare specifically, is really about reducing corporate influence in our elections and in Congress. That must remain a major focus even as we push for Medicare for all. Things like passing HR 1, the For the People Act, and other democracy or voting rights improvements and protections will be crucial for passing anything in the progressive agenda, including Medicare for all. Things like ending Citizens United, which allows corporations to funnel money into the fight against all sorts of progressive priorities, including Medicare for all, campaign finance reform to improve accountability of legislators to their constituents instead of to wealthy donors and corporations, and passing limitations on the revolving door of corporate lobbying firms where they're hiring folks directly out of Congress or out of the administration to fight back against the needs of the American people. And then some other factors that would help that really are sort of more in the legislative realm, in the sort of the healthcare realm, ending the filibuster. That one would be a big one, as so many fights right now, we're seeing the filibuster serve to protect the privilege of a minority of politicians, many of whom are the most bought off by corporation. Ending the Hyde Amendment, which prevents federal funds from being used for reproductive health procedures, including abortions. Interim improvements in healthcare, as Amirah flagged, such as adding dental, vision, and hearing to Medicare, lowering the Medicare age, adding an out-of-pocket cap on expenses in Medicare, and allowing Medicare to simply negotiate lower drug prices on behalf of all Americans. These would be crucial steps. Another important thing that can be done, by all of us, is really taking on Medicare Advantage and other privatization schemes directly. There are many steps that the Biden administration could take to crack down on the fraud, waste, and abuse of Medicare Advantage and other programs. There's also a few factors that I want to flag that would make it harder to pass Medicare for all. Uh, Things like further privatization of Medicare or other public health goods, such as expansion of Medicare Advantage or Medicare Direct Contracting, now being referred to as ACO REACH. Sort of a flip side to the importance of voting protections. Expansions of voter suppression across the country really threaten our ability to elect the people that can deliver Medicare for all, and also in any policies that would increase the powers of corporations that are lobbying against Medicare for all, including big pharma, the insurance industry, the hospital industry, and private equity and venture capital firms, which we see increasingly buying up different aspects of the American healthcare system in hopes of making a quick buck. And so finally, I want to turn to the steps that you can take to help make Medicare for all a reality. One of the most important things to do, and as Amira flagged ahead of the Senate introduction and during the Senate introduction will be a crucial time, is to communicate to your reps and senators in Congress about the need for Medicare for all, especially what it would mean for you and your family. Personal stories and connections are crucial. As Amira flagged, the COVID-19 pandemic, brought healthcare front and center to all of our lives, and it's really important for your members of Congress and senators to understand just how challenging it was for you to get through this period. And even if you had good health insurance, it was never easy to try to negotiate across all of these different programs and figure out what was possible. And so there are a number of ways to do this. Calling your rep or senator's office and speaking with whoever answers about the need for Medicare for all. Writing a letter to your reps and senators describing what Medicare for all would mean to you. Publishing op-eds or letter to the editors in your local papers. Politicians pay attention to this, especially in election years. Requesting a meeting with your reps or senators. It can be easier if you're working with other constituents in your area or organizations. And if your member is already a co-sponsor of Medicare for All, ask them to join the Congressional Progressive Caucus or the Medicare for All Caucus to help them more closely work with the folks fighting to get Medicare for All over the finish line. And if they've done all these things, a genuine thank you can go a long way to keeping them on the bill in future sessions. We also want to. I also want to talk about the importance of communicating with your state and local reps. State and local reps can be easier to meet with, and many have their eye on higher office. So the relationships that you build now can be with folks that you'll see in Congress later. One of our big pushes is around passing municipal or county resolutions for Medicare for all, which can help connect you with like-minded activists in your area and also put your city or town on the map as a place demanding Medicare for all. We're approaching 100 resolutions, and we're at this conference. There'll be a number of sessions, and I hope you'll join one of them. But you can also find more information at medicareforallresolutions.org. The number 4, again, that's medicareforallresolutions.org. Just want to thank everyone for joining us today, and hope you enjoy the rest of the conference.